Every one of us have spent a lot of money on electronic records, and why we can't use those systems to communicate with one another outside our four walls makes no sense whatsoever.
The most compelling argument I could make for participation in health information exchange would be that it's the right thing to do for patients. We are excited about the collaboration between Missouri Health Connection, Burrell Behavioral Health, and Jordan Valley Community Health Center, particularly around the idea of a targeted population that has tremendous behavioral health need, which is pregnant women.
What our focus is on that population that's somewhat economically disadvantaged, is requiring a little additional care than what you would need during your standard visits to, possibly a prenatal or an outside obstetrical services. They're a high-risk population.
Sometimes young women who have, in particular, substance abuse disorders, substance abuse difficulties.
For safe and healthy babies, those things just have to be addressed.
These women that we're talking about in particular may be very much self-medicating. They're trying to solve a problem that they have, which is that they feel lost, they feel alone, they feel scared, they feel anxious.
I do believe that this is a complicated patient who may see multiple providers, who may interact with the hospital emergency room, who will get counseling services over at Burrell, and possibly medications prescribed. And unless those are available at the time of the visit, our providers do not have accurate information of the patient.
And I think that's one of the things that we're very excited about with the Missouri Health Connection project and partnership, is making some real progress toward getting the right information into the right hands at the right time to facilitate the kind of care we're talking about.
There's no doubt about the benefits that would be revealed by having a more unified electronic record of an exchange of information.
When you have that kind of information in your hands as a provider, you can begin to say, we need to think about a different way of treating this person. And that's when I think you begin to see cost-effective, high-quality care.
Right now, I think healthcare, quite honestly, is still very much siloed. The Missouri Health Connection application, in my belief, will start to break down the silos that exist within our community between those institutions as they currently are. And unless we can start having an impact on how patients perceive their health care and pursue wellness, we're not going to be able to treat the patient in a more holistic and comprehensive manner.
In this case, we have a targeted, very circumscribed population, several hundred women a year, and we are fully convinced that the collaborative treating of the problem is going to result in reduced rates of low birth weight babies, reduced fetal alcohol syndrome, reduced child abuse and neglect among those populations. Not only is this young mother's life better, not only is she healthier and happier and more prepared, but there's a little life coming into the world that has a better start. And we all know that beginnings are awfully important, and healthy starts are incredibly important.